Uh, but we are moving on to a show. We're going to be talking to someone that I've known for some time. She's been on the show multiple times on WVON as well as now on StreamYard. But this is Adelina Marshall. So my mental health just went up about 80 points because she's on the line. But she is a phenomenal, phenomenal RN. She's a VA Mental Health R.N. And she has been working at Jesse Brown for some time, helping people go through crises, stopping people from committing suicides, which still is a national problem that we're facing. But we're going to have a discussion today about Jesse Brown VA. National Nurses United met with the VA Secretary McDonough and to find out what was that meeting about and why was it so important for them to meet with someone who's in the VA system. How are you doing, Adelina?
I'm doing well, and how are you?
Oh, fine. If I'm doing much better. I said since you came on, my mental health has improved already. I'm smiling.
And
You see what kind of effect you have.
yeah. Well, we've been in Washington and had meetings yesterday and today, and the secretary has stated that they're trying to get additional $12 billion
Mm,
for VHA to increase hiring because right now I'll say a delay versus a freeze because they're going to hire certain strategic areas as needed.
mhm,
However, of course, we need more social workers, more health techs, more psychologists, more psychiatrists in the VA, and that takes money. We
mhm.
found out also that 78% of the VAs are 4 and 5 star care centers, which is always good to know.
Wow.
Yeah. We also are have gotten more veterans to sign up for VA care, but we still want more to come in. And we discuss extending hours in the clinics for our veterans because now with the job unemployment rate low, we know that many of our veterans are now working, and we're doing or going to do in discussion to see how we can provide longer clinic hours, maybe not every day, but extended hours once or twice a week so that we'll be able to meet our veterans' needs.
Oh, that's fantastic. Yeah, because the people realize need to understand that a veteran's mental health needs extends to their entire family. It's not just the individual and their community and their workplace. And so this is something that really requires adequate professional care. And the one thing I know about the VA is when you walk in as a veteran, you're automatically surrounded by other veterans who are there, going for their clinic appointments. And then you even have people who are working within the VA who were military as well, Air Force, Army, Marines, Navy, so Coast Guard, people can even walk through. But
Yeah.
this is the kind of thing where, you feel like you're at home and you have people who really are concerned and know what you've gone through by talking to veterans. There's a focus there, whereas if you go to a place that's outside and they don't know anything you've gone through, I have to explain. If I go to a outside provider, I have to go through explanation of everything that I've done with the helicopters, crashing with helicopters, IED explosions, RPG, and but there is a consensus. People understand what you are going through. So I've always felt that warmth, when I go through the VA system. So I'm hoping what you're saying is true, that people really come back and consider that. And I didn't know about that 4 or 5 star status. That's amazing.
Yeah, it's really amazing.
Yeah.
We also are looking at hiring more medics from the military who they're
Mm,
non-licensed
mhm,
personnel, but their experience that they gathered while in the military can go a long way in assisting the staff in the ED and ICU. So they're looking at extending that program to bring more of them in. Right now, the Cleveland VA has a program supporting our medics there.
Mhm.
Also, we have a lot of veterans who work at the VA that are still on active duty. They're out of, I guess, out of the. They're still in the service, but they're on. They have to do still some call ups and stuff. So they're there, and they're very current with their interactions with our veterans. So our veterans look forward to know that veterans are caring for veterans, and our staff at any given time, the doctors, the nurses, the social workers, food service, cleaning personnel, they are all,
Mhm.
many of them are veterans themselves. So we have veterans throughout the VA healthcare system that is there to support other veterans.
Yes, yes, and we're going to have the Honorable James D. Rodriguez on later on in the show, and he is actually the Assistant Secretary for the U.S. Department of Labor, and he's with the Veterans Employment and Training Services, the VETS program, for training veterans and that kind of thing. So you bring up a really valid point. That transition from active duty military service, or if someone is part of the Army National Guard, Air National Guard, that they can still have another career track, and they need to start thinking about that when they're coming out. Going to school, you have the GI Bill, to get them trained.
Right.
But we definitely have a shortage of people who are trained in all medical fields. We're all feeling the crunch from that.
Yeah. Well, those veterans go
Mhm.
on to become nurses and doctors and social
Mhm.
workers
Mhm.
out of these programs. So we're ecstatic to have them come into the VA, and in private sector, they would
Mhm.
not get that opportunity. But the
Yes.
VA acknowledged their experience and have found a way that we can keep them in the medical field, and they could go on with their education and
Mm.
stuff. We also want to let our veterans know that instead of being in a community, we really, really want them back into the VA. And
Mhm.
we want them to know that even though we may not be able to see you in a 30-day period, we may be able to see you on that 31st day or that 34th day. Whereas in private sector, you still may have to wait a
Mm.
longer period to be seen.
Yes. Mhm.
So if you're here this program, please ask that, you know what, if you can get me in on that 32nd day or that 34th day, please go ahead and schedule me. It's important also that our veterans who have appointments, they can't keep the appointments, please cancel, because there's other veterans that
Yes.
are waiting, and we can maybe get you rescheduled, but use that open slot to bring a veteran in who is currently waiting to be seen.
That's a very, very excellent point. That we have to be mindful that we're part of a system, and other veterans and their family members, depend on those services, and just to make appointment and break them, really, it damages the ability of the VA system to respond adequately to people who are really in need of those services in a critical way.
Right.
Um, but we've had gone through COVID, and all the mental health considerations. We've been talking mostly about children, what they've gone through, from being pulled from school, those kinds of things. But what do you think the impact is on veterans? What are the mental health challenges that veterans are facing now? Are they any different since in the post-COVID time period, or we still have COVID around? I don't like to
We
always say
still
post.
have COVID, and
Right,
to
right,
all of our listening audience,
right.
COVID is still out there. I mean,
Yeah.
every day, even among my circle of friends, recently, two
Mhm.
of them have come down with COVID, and they're shocked because they
Yes.
know.
Mhm.
to still keep that distance, whatever, but it is still out there. And, we'll be going into the flu season also. So if
Mhm.
you need to get vaccinations, please,
Mhm.
think about it and get it early,
Yes.
before the flu season hits us. I think COVID has impacted our veterans by having some of them isolated,
Mhm. Mhm.
and they lost that interaction. Many of them were coming in for group therapy, and then that was, delayed. We're
Mhm.
now offering video therapy, video healthcare if our veterans need it and can't come in. But
Yes.
I just cannot stress enough on how much our veterans need to come with us. It's just like you said, in private sector, they have to start all over again. And I'm a private sector
Mhm.
um, patient, and I have to wait sometime 2, 3 months
Oh,
to get
sure.
an appointment. So
Yes.
even if you're seeing a specialist, it might take longer. Even my dentist is like trying to make appointments 3 and 4 months out, because even in that field, dentistry, there's a shortage. There's a shortage of healthcare personnel all over. So
Mhm.
by the VA asking for this additional $12 billion from appropriation, we need that money. Our Congress went on a hiatus without addressing this, but we need our veterans to flood those lines, send emails, call,
Mhm.
encourage your representative to support the VA. By supporting the VA, they're supporting you as a veteran. And while they want to make going into the community sound wonderful, your best care is in the VA. Our
Mhm.
nurses, and I know many of our other staff, are really committed to our veterans. We
Yes.
see them all the time. They're like family members, and we take ownership of our veterans. I mean, some of our
Mhm.
nurses sometimes get in trouble because they're taking ownership of that veteran, and they don't get in trouble for advocating for, but they become very overly protective. So that's to the extent that we love our veterans, and we want them back in the VA.
Oh,
So,
that's great. Yeah, because
yeah.
because you were talking about the scheduling issue in the private sector, and I remember back in was it in April, I was trying to make an appointment, and the person said, and I said, well, when's the next appointment with realty? She said, what about October? And I said, which year? They didn't think it was
Yes,
too funny.
yes, they
But
are scheduling out into 2025 now.
right.
Our growth rate is at approximately 6%. We
Yeah.
would like to increase that, you know, to 10 or 20%. The more veterans we can get in, the more better their recovery outcome will be. Because we were discussing today with some of our leadership in VA for nursing, and we know that many of our veterans have more comorbidity. So if you go private sector and say I go because maybe my blood pressure is high, well, we're not going to just look at your blood pressure. We're going to look at whatever other problems you may be having. And we're not timed by how many patients we see. If we have to see 20, 30 patients that day, we're going to see them. One of our nurses said one day she had 45 patients in her clinic. But you know what? We're going to stay there. We're not going to take our breaks. We're going
Mhm.
to make sure that you're going to get the kind of care and a high quality care by coming into the VA.
Yeah, and there's something about that. Over the years of practicing medicine, so I really started practicing medicine back in the 1980s. And over the year, there's been kind of an erosion of that personal contact that you see sometimes.
Yes.
And I don't see that in the VA. I feel like you were saying that they are there to support you and care about you.
Right.
And it's not that's not a number, you know.
Not a number. No.
Yeah, and you have people who are there who are specialists who are really well trained. Plus,
Mhm.
the VA actually has you know physicians and nurses, I guess, who are connected to the University of Illinois, Rush St. Luke's, Stroger Hospital. So you have some
Northwestern.
Northwestern, some rotation,
Northwestern. Yes.
right, right, and these are really highly skilled people in an academic center that are on the top of what's going on for treatment.
Certainly.
And so I could see why you have the 4 or 5 star status.
Yeah.
But I've always had a great experience when I was there. So,
But even though we have,
mhm,
our doctors and interns and our medical staff coming from those sites, your nurse is still the one that's going to oversee them, going to
yes.
challenge them.
Hmm.
If we think we have that freedom, we have that freedom because we're a union hospital. So
Hmm.
we don't
Hmm.
have to worry about someone feeling that they can't be challenged. We will challenge them.
Hmm.
And we're a team. And
Yes.
so the doctors aren't above the nurses. We are all a
Hmm.
team,
Yes.
including social workers and health techs. And so you got that team who's not afraid to speak up, who's not afraid to say, well, doctor,
Hmm.
and I don't want to forget our MPs. We have a
Hmm.
lot of great MPs, and many of our MPs are
Hmm.
also soldiers. They're on reserve. That's the word I was looking for. We have
Okay.
reserve
Hmm.
staff there, and
Yes.
so we're not afraid to to ask questions, to say, well, doctor, did you look at this? Do you look at that? I had one situation where someone was having heart problems, and we're like, well, did you look in the back of the heart? Did you look at the arteries and the veins in the back of the heart?
Hmm.
And that challenged that doctor to look a little bit further. So
Okay.
we oversight them,
Hmm.
not to say that they're not doing their best, which they
Hmm.
are, but
Hmm.
we're not hampered by a hierarchy.
Right.
We
Right. Right.
are
Hmm.
there, we have a voice, and we have a voice for our veterans. And we want our veterans to know that your best advocate is your nurse.
Hmm. Yeah, and and we have when we're in the military, on the battlefield, people work as teams. And what you're looking for is the best outcome. So everyone goes home, so
Right,
everyone, they don't suffer consequences of an injury.
right,
Um, so this is something that I think it's essential for people to get in their minds that this is a team sport. It's not an individual sport.
right.
Uh, but what as far as the mental health services, where do you think that we need to strengthen our efforts as far as the types of diagnoses? I know depression is probably one big one. PTSD,
PTSD, yeah.
yeah, all those.
We have to strengthen by, like what I stated, we need our psychologists and we need psychiatrists. And in the VA, what is unique about the VA, our veterans get to talk to the psychiatrist. That
Mm-hmm,
psychiatrist is not there just to write a script for them. They're there to interact with them
hmm.
and to work with our veterans. Veterans are part of our partnership,
Yes. Hmm.
and
Yeah.
listen to them and come up with the best treatment plan for that veteran. And that veteran has a say so in their mental health care that we're provided. If you're on a medication and you think that medication is not working for you after, it doesn't necessarily kick in right away. Some of those may take 7 to 14 days, 21 days before you'll see any kind of outcome. But after being on it, appropriate time, if you feel it's not working for you, you have that right to talk to your doctor and to let your doctor say that. Your doctor does not have the right to say, well, this is what I'm giving you and you're going to take it. No,
Hmm.
you are heard in the VA. your concerns are heard in the VA, and your concerns are shared among that team in the VA so that we can hear you. The best road for our veterans to
Mhm.
recovery is that road that leads to the VA.
Okay, yeah, yeah. And what about the training programs? Because we do need more mental health professionals. I know, the number of psychiatrists, psychologists, mental health social workers, RNs. Is it's not where it should be. Um,
It's
and
definitely not where it should be. And I, for one, advocate for more training for our staff. Eat
Mhm,
that training that the RNs get. I'm a big advocate that our health techs should have that same training because they are our
mhm,
eyes and ears when our patients are coming to the VA. They may see something that we need to know about. So we need training, more training across the board, not training on the internet and TMS. We
mhm,
need more one-to-one training. A lot of things have transpired for our veterans who have addiction problem. There are drugs out there that we need more training on it. How is it affecting our veterans? And I
yes.
personally feel that anybody sell our veteran drugs, if they're caught, there should be a higher penalty for them
Mhm,
providing that to our veterans. But
mm.
we need to have more knowledge, more current knowledge of what is going on in the community, and then we need to have that opportunity to educate our veterans more about their own health care, how illicit drugs impact mental health, and we want them to have that knowledge so if they make that decision to
Mhm.
participate in that they'll know the harm that it can cause them.
Did you ever have to do, work with families, the spouses of a veteran who maybe has really difficulties with PTSD or those kinds of things? I know people are, using service dogs now and all that. I'm not
Yeah.
sure if, how the
So
mental health, yeah. Mhm,
when our veterans come in, they get to talk to the social worker who can help them and explain more to them the availability. More and more of our veterans are getting not just dogs, but service animals. I've
mhm.
even had a veteran that had a cat.
Oh, I have one too, so
Yeah.
I feel for that person.
So, yeah. So, and then also when they seek help, our social services will work with them to get care for their pets
Mhm,
so that they can feel comfortable in coming in if they don't have anybody to take care of them.
right.
There are volunteer services out there that can provide that care for their pets while they come in for treatment.
Oh, nice.
There's also recently
Mm,
a program that is they're trying to get it up and started that they're going to be connected to other VAs throughout the country. So, say if Jesse Brown doesn't have a bed for PTSD treatment, they're going to have a clearinghouse. And we can
mm,
say, well, there won't be a bed at Jesse Brown for maybe 6 weeks,
mm.
but maybe we can get you into another program that is, it may be out of the city or out of state, but this program has beds and we would like for you, if you're willing to go there to start your treatment.
Excellent. Yeah.
And then also the good thing about our mental health care is that our veterans sometimes completes our program. But I tell them if you need a tune up, it's
Mm,
6 months or 3 months or a year from now, you feel that you're kind of getting to a point that you need some more care, then
mm.
please contact us and let us know. And if we can get a bed, they can bring you back into that program to help you get stabilized and build on what you have already been treated for.
Okay.
But in private sector, you're not going to have that if you don't have great insurance.
Right. Right.
Uh,
Well, it's we're running out of time, so I just want to know how would someone reach out really quickly, to make sure that they get their appointment at the VA, and I know there's CBOTs out there as well, but to make sure they can gain some of those services. Is there a number like they can
So
call or?
I always encourage our veterans to go online, and
Mhm, mhm.
they can get information into the programs that's available, and
Okay.
then call your local VA, because
Hmm.
we're not just in the Chicago area, we're throughout the
Everywhere.
nation, and
Yes,
so there'll be other phone numbers. So for wherever they're located at, start with going online,
and do a
and
Google search. Yeah,
yeah, Google search,
yeah,
and
yeah,
you
yeah.
can get a lot of information.
Hmm.
And if you feel that these programs will help you, then do that. I mean, we have
Okay.
stuff with the burn pit, and
Oh yes, yes,
recently reading about that, the diesel fuels and stuff can
yes,
also
yes,
impact your hearing.
yes,
So we
yes,
want our
yes.
veterans to be able to ascertain as much information as they can.
Okay.
And once they do that, they'll realize that the VA is there to help them.
Okay. Great.
And we want to take the fear out of our veterans seeking mental health care.
Services.
Yeah.
Yeah, good.